Thank you. Thank you, Clark. Thank all of you for being here. Those of you who were here the last time I spoke know that I like to walk around. I know we've got cameras everywhere, so I'm going to try to stay still today. We'll see how well I do with that. Having said that, my purpose today, as Clark explained it to me, was to talk a little bit about being a medical director, particularly of a long-term care facility, and that generally means a nursing home. And I will talk about that. I will also let you know I've been a medical director for not only nursing homes, but assisted livings, also in terms of home health agencies and hospices. And so if there are questions that you have related to any of the medical director roles or any of the other things related to geriatrics, I'll be happy to address those during the question and answer period. I won't do a terribly long job of speaking. I will try to give you sort of things encapsulated and then offer lots of opportunity for discussion so that we're sure to address the issues that you all have as priorities. Let me give you a little bit of background in terms of a medical director, though. A medical director doesn't need any specific type of training to be a medical director for a long-term care facility, a nursing home in particular. There is certification that one could get, and you could become a certified medical director. It's not necessary to do that. One exception is the state of Maryland, interestingly, has a requirement that a medical director for a nursing home have some specific training related to being a medical director in long-term care. So many medical directors in Maryland actually go through a certification process, since the training pretty much gives you that certification anyway, and they'll get certified as a medical director or CMD. I actually happen to be a certified medical director. Doesn't really make much difference in terms of how I practice or anything else, but some extra initials to put behind the name, and my mom used to love that. No, I'm just kidding. But so the reality of it is while there is some additional training that you can take, it is not mandatory to have that to be a medical director, and I don't know that there's a huge distinction among individuals that have gotten a certification versus those that maybe had fellowship training in geriatrics and learned about being a medical director, or those who have spent many years working as a medical director in a long-term care facility. Having said that, there are some things that all medical directors have to be able to do in that role. One of the things is that they have a responsibility for the clinical care in the facility. A number of years ago, there was an organization called the American Medical Directors Association, and they, I will say this sort of tongue-in-cheek, they thought they weren't getting enough respect, and so they pushed to have some legislation move forward that would create a federal tag, if you will, for nursing facilities, so that the medical director had certain responsibilities and certain roles in the medical director position. While some of the leadership of that organization thought that was a good thing, what it really did was made medical directors targets for malpractice attorneys, and it probably made them more susceptible to being cited in terms of regulatory oversight from federal and state agencies, and I'm not sure that it really gave us any more respect. That's usually what happens when you go through a process where you get the feds involved and you require some type of regulation and some additional targeted responsibility. Now, having said that, what does the medical director have to do? Well, when I say that they have clinical responsibility, they really do have clinical responsibility for all the care that takes place in the nursing facility. There are other physicians that work in a nursing facility, and those are oftentimes not affiliated, in fact, usually not affiliated with the facility itself. Those individuals are called attending physicians, and they provide the general day-to-day oversight and care for any residents that are in the nursing facility. If, however, those individual attending physicians are lapsed in their visits, if they deviate from the standard of care, if for some reason the health care of an individual who is a resident is not up to the caliber or the quality that either the nursing home or regulatory oversight requires, the medical director often will get involved, either have a discussion with that attending physician, or in dire cases may actually intervene to assure the safety of that particular resident. For an organization like this, where we talk about individuals who are going to spend perhaps the rest of their life in a nursing home, it becomes of importance to understand some of those dynamics. So if you have an issue with the care that is being rendered to someone that's in a nursing facility, you have a number of options in terms of bringing it to attention of staff that are part of the nursing facility or the attending physician. So the options that you have, you can talk with the nursing staff, which is usually the first line. If there's some concern, maybe medications you're concerned whether they're giving appropriately, or whether the meals are being provided, the right diet, whether or not bathing is being done appropriately, dressing changes, anything that you might have a concern in terms of the care that's being rendered in that nursing facility. Usually the first line of discussion takes place with the nurse who's charge of the particular individual. And once that concern is expressed, generally whatever the issue is explained to your satisfaction or resolved, and everything just goes along, hopefully in a manner of good, compassionate care. Occasionally, however, there is less than a satisfactory response, and in that circumstance, oftentimes the next level of concern, if you will be addressed perhaps to the director of nursing or to the administrator. The administrator has oversight of the entire facility and has also responsibility to make sure that care is being rendered appropriately and that regulations are being followed. The other recourse that you have, particularly if it has to do with a resident's medical care being rendered by the physician, is to talk directly to the attending physician. My husband, my mother, or whatever has hypertension, and I notice they're not giving that medication that they were taking in your office any longer. Why is that? Is there something we need to change? The attending physician has the responsibility to prescribe pain medication, to prescribe any other medications for disease processes, and to oversee dressing changes that might be necessary, or if there's a question about the caliber of care and you're not getting an adequate response from the nursing staff, you can certainly go to the physicians, and many times issues that are raised go from the nursing staff directly to that attending physician. When the response from the attending physician is not adequate, everybody will go to the medical director, because generally it's better to deal physician to physician or physician to other healthcare provider, whether that be a physician assistant or a nurse practitioner, which are becoming more and more common in the nursing and home environment. The medical director then has the responsibility to review the records, to evaluate the resident, to determine whether or not the care that is being rendered is appropriate. And that doesn't mean, well, I like to use this particular drug for blood pressure and you like to use that particular drug for blood pressure, so you have to do it my way. That's not the way it works. But where there is clear breach of what is the standard of care, or where there is a violation of regulatory requirements, that medical director will step in and make sure that the attending physician adheres to those regulatory requirements. In very dire circumstances, it may involve disciplining the attending physician. In some circumstances, it may be terminating their clinical privileges in the nursing facility so that they can no longer see patients in that particular facility. In those circumstances, another physician will be offered that will be overseen by the medical director and the administrator and the director of nursing. So recommendations for other attending physicians may take place. In the worst case scenario, where you can't get another attending physician, the medical director will take responsibility for the care, take over that care, until another physician can be identified. And so that is a process that oftentimes will happen when there's been a particularly egregious oversight, where there's been a problem with an attending physician that has required them to be removed from staff immediately. So, for example, if the licensing board takes their license away, they can't practice, meaning the attending physician can't practice and can no longer see a patient in your facility. Hopefully, we will have been notified about such a circumstance well in advance and be able to prepare for the potential that something like that could happen. But occasionally, something happens either related to that, or, let's face it, all attending physicians are also human beings, and if we get hit by a bus walking across the street, like everybody else, we don't do our job the next day, and somebody else has to pick up the slack. And in some circumstances, a tragedy like that, the medical director would step in for that short period of time while we're trying to identify another physician, especially if it's a small practice where they don't have other physicians who can step in to take over that role.